Southwest District Health will no longer offer COVID-19 vaccines, becoming the first health district in Idaho to do so. Its board made that decision this week after hours of testimony and heated discussion. Southwest District Health serves Canyon, Adams, Gem, Owyhee, Payette, and Washington counties. And as Abby Davis found out, the board received hundreds of public comments before the meeting asking them to pull these COVID vaccines.
Brian, ultimately, the majority of the board felt like there was too much uncertainty about whether the vaccines are safe, going against the CDC and the district's own medical director's recommendation. At Southwest District Health, COVID-19 vaccines are now a thing of the past.
I disagree fundamentally with the idea that available is promotion. I don't agree that just because it's available, that's
why don't we make other dangerous substances available at the public health?
Well, what about somebody who doesn't believe that it's dangerous?
It was a contentious debate Tuesday, but the board decided in a 4-3 vote not to carry the vaccines because of what they're calling safety concerns.
And the efficacy as well is not what we've been told.
I just don't feel comfortable as a board of county commissioners making determinations on the quality of pharmaceuticals, how they're produced.
The health district's medical director, Dr. Perry Jansen, said the district should continue offering the vaccines.
Recognizing that we always have these discussions about risk and benefit. This is not a blind, everybody gets a shot kind of approach. This is a thoughtful approach.
He listed various health agencies and universities that still recommend COVID-19 vaccines, including the Idaho Department of Health and Welfare. The CDC says everyone ages 6 months and older should get vaccinated.
Recommended at 6 months.
About a half dozen doctors against the vaccines then spoke. That includes the lone physician on the board.
This is patently absurd and presents much more risk than benefit.
The board even heard from out-of-state doctors, some widely accused of spreading conspiracy theories and misinformation about the vaccines.
They were never safe. They were never effective.
Dr. Jansen pushed back.
This is not a consensus opinion.
Board Chair Kelly Aberstury called the decision disappointing. He worries it will disproportionately impact lower-income people since anyone paying out of pocket for a COVID-19 vaccine would pay less through the district.
I'm not a big fan of the shot myself. I don't think it's effective. But I believe that's between the doctor and the patient, not me as a board member.
I talked to former CEO of St. Luke's Health System, Dr. David Pate, about the decision. He also served on the governor's COVID-19 task force. He told me over the phone the decision shows some of the board members are not serious about public health, saying early on in the pandemic there was some room for doubt, but now we have plenty of overwhelming scientific evidence to base these kinds of decisions on, and it really refutes the nonsense that some of these doctors are spreading. He also said, Brian, this decision plays into anti-vaccine narratives that are creating distrust around other vaccines as well.
Yeah, well, so I wonder then how many of these COVID-19 vaccines were they giving out at Southwest District Health?
Well, last year, a spokesperson says they vaccinated 209 people. This year, they've vaccinated 64 people so far. They do still have some doses left, and they plan on giving those to patients at a skilled nursing facility next week.
Okay, so the demand was going down, I guess, as we got through the years. The other question was Dr. Ryan Cole part of this presentation?
He was, yes.
Okay, and he was the one who had his license restricted in the state of Washington for spreading misinformation about COVID-19 as well. All right, well, thank you very much, Abby.